My name's Claire Howard. I'm the National Quick Lead for Medicines Use and Procurement working for the Department of Health. We think about the relationship between patients, the NHS and the industry. Medicines optimisation gives us a platform upon which to finally have a proper relationship. We need to be able to work in collaboration with them so that we're working together to tackle some of these things rather than in isolation.
For me, this is perfect. We're hearing about how medicines optimisation fits in across all different sectors and how we can incorporate that into all the different aspects of my day job.
Attending the forum has enabled me to network with a lot of people. There used to be regular conferences that we were able to attend to do that, and it's always a good way of catching up and finding out what else is going on in this system, in the health service as it transitions.
I think the biggest highlight is the ability to network with the rest of my peers and discuss the huge changes coming in the way that we deliver pharmacy, both in primary and secondary care. Today's forum will allow me to actually ensure that the service I'm providing is up to date and relevant to my patients and the current pharmacy agenda.
The main highlight for me has been Keith Ridge's presentation, which I think has helped me to define medicines optimisation, certainly from the way in which the Department of Health is seeing this, and I think really to help me to benchmark that, I think, against what we're currently doing in secondary care.
Attending today's forum has reignited the flames within me, the flames of enthusiasm to do more. We have all the skills in pharmacy, we can improve patient quality, and today has just reinforced that message.
Today coming in, there was a real buzz and excitement. The fact that there is senior leaders, not just from industry but also from the NHS, gives a real indication that there's a desire to want to join in partnership and work towards a journey of medicine optimisation.
I think the forum has provided a very good platform for the sharing of good ideas and best practice. The Learning Zone, particularly with all the posters that were there today, with lots of very good examples of how local areas are working on the medicines optimisation agenda and doing things now that are making a difference. I know there are hundreds more examples out there that weren't here today that we could have shared in the same way. Let's go out and talk to each other, share these ideas and try them. See if it works in your area. There's no harm in trying something different.
There's lots of ideas, lots of inspiration, lots of things to think about that we can do things differently in the future, and refocusing some of the work we're doing so it gets a better outcome.
I've had some really good conversations with the customers today about medicines optimisation, how they view the future, their challenges, etc. If I was going to pick one, some brilliant work that's going on in Scotland, how primary care and pharmacy are integrating to bring much better service to patients, and that is something I want to carry on the conversation about after this conference. It's been brilliant.
I hope that today people have got inspiration and some really practical ideas to go back to their organisations with and really think about what medicines optimisation means for them. And hopefully in a year or two's time, when people have started to put some of those in practice, have the opportunity to come back and share those.
I would definitely highly recommend coming again to one of these forums. We are actually optimising medicines all the time, but we need to talk about it more and we need to have confidence in what we're doing.
The forum has been excellent. Any colleagues who haven't attended this time should attend next time. It really is great to bring together so many people from so many sectors looking forwards about what we can do to plan our strategies and implement medicines optimisation. So come along.